Hi, everyone. Welcome to our Med Mentor Monday. Today, we're going to be talking about why we love medicine, what we love about medicine, how we got into this awesome field. And just to start off, we're going to just introduce all of our panelists. Maybe, just name where you're from, where you went to undergrad, and whether you did a gap year or not.
Okay, cool. I can start. Hi, I'm Candace. I'm an MS1 in DGSOM, but I'm also in the MD PhD pathway. I went to undergrad at Berkeley, and I did not take a gap year.
I can go next. Hi, everyone. My name is Emilia. I'm also an MS1 here at DGSOM. I grew up in the Bay Area, and I went to college at Case Western Reserve University out in Cleveland, Ohio. And yeah, super enjoying my first year and happy to be here.
Hi everyone, I'm Keely. I'm an MS2 here at DGSOM. I'm from Tucson, Arizona, and I also went to undergrad there at the University of Arizona. I graduated in 2020, so I went straight through to med school.
Hi, I'm Christina. I'm an MS3, and I went to UCLA, I went to University of Michigan. I'm from Maryland, and I did take a gap year, and I did the NIH.
I should clarify that I also did not take a gap year. I went straight through.
Awesome. Great to see you all. Okay, so maybe we can get started with some pre-med experiences. So maybe you could tell us a little bit about what, I don't know, some of the key memories you have from pre-med were that led you to medicine or applying to medicine, just very general to begin.
Yeah, I was always interested in like science and medicine from a really young age. I had like parents who were sick a lot. I was sick a lot. If you see something moving in the background, that's my dog. And anyways, I was like in contact with physicians a lot. And so I was always interested in the field. But I think my turning point was when I was in college. I was just on a random Uber ride. And the driver was telling me about how his doctors keep telling me to take insulin. And he was like, no, all my friends that started insulin ended up doing dialysis. So that's just like a trick that Big Pharma was trying to get you hooked on. And so I took the car ride. We were conveniently stuck in traffic. So I took the car ride to talk him through like what insulin is, what it does, and why he should do it. And I left that car ride feeling like I made a difference. And so it really was important to me that I took this path because I really felt like making a difference, like it did something to me. So that's where I am.
I can go next. I also have been interested in medicine from a young age. My mom's a cardiologist, and so I sort of grew up seeing that and seeing my mom being very fulfilled by her practice and have these very long, lovely relationships with her patients who adore her, and that definitely left an impact on me. A lot of sort of our family friends happened to be in medicine because they were her friends in medicine. So I sort of grew up around that, but I didn't decide for myself that I wanted to go into medicine until college. I got my EMT license as a freshman in college, sort of on like a super random, I just decided to go for it. I don't really remember what really prompted that, but it was on a whim. I was never really the most I don't know, like action oriented person, kind of shy before that, and EMS just seemed like an interesting challenge. And I got my license, and I was an EMT. I volunteered with our student-run collegiate EMS for the 4 years of my college, and that was an absolutely transformative experience. I really learned a lot about myself, what I enjoy, where I hold my self-esteem, and how I actually enjoy being a more sort of like action-oriented person, a person who is willing to sort of step in when things are going wrong. I had a lot of fun with it. Learned a lot about sort of medicine and healthcare delivery in the United States, specifically in Cleveland. I don't know if you guys know much about Case Western, but it's one of the 4 huge medical institutions within like 10 minutes of a drive in Cleveland, yet there's a lot of underserved communities in Cleveland, just because of the way healthcare is sort of structured, and the way insurance is structured. You know, a lot of people from all over the country come to Cleveland, especially the Cleveland Clinic, to access some really high level, tertiary level care. But a lot of people in our own community don't access that level of care. So it sort of was a firsthand look at medicine in the United States. It really sparked my interest in public health, health equity, and health disparities. And that's a really long answer to how I ended up here. I decided that this was really the path for me.
I'll speak to a couple of my most memorable or favorite experiences that I did in undergrad. One was called Flying Samaritans. I think UCLA might have a chapter as well. But essentially we would do monthly clinics in Agua Prieta, Mexico. Since I went to undergrad in Tucson, it was really nice because the drive to the border is only about an hour and a half. So we would just spend the whole Saturday going to clinic in the morning and coming back in the afternoon. And I loved that experience because I really got kind of firsthand exposure to like taking a patient's history and, you know, shadowing the physicians out there and becoming more proficient in medical Spanish and just really talking with the people there and understanding their health issues and what they wanted to get out of their visit. It was such a rewarding experience, and I knew that that's when I really wanted to work with people and work on making them feel better and just doing the most that I could to improve their health, not only for themselves, but for their families as well, because a lot of the patients would come with their kids or with their husbands or with their aunts and uncles, and all of them, you know, had a chief complaint that they were coming in with. And so it was nice to make them not only feel better, but also develop longitudinal connections with them. I'd been in the club for 4 years, and I remember there was this one patient, she had diabetes, and I was helping her my freshman year, and then I actually told her when I was a senior I had gone into medical school, and then I wrote about her in my application. So that was like such a rewarding thing. So that was one. And then another one was the research I was doing at the time. I do want to go into cardiology now, and I actually became interested in cardiology in undergrad through the research I was doing, and also just kind of the clinical profiles of the patients that I was working with. I researched pulmonary hypertension, right heart failure, and like cardiovascular disease. And you can imagine that, you know, a lot of patients in maybe more under-resourced communities may be suffering from cardiovascular disease or have risk factors that predispose them to cardiovascular disease. So I really saw a connection between the research that I was doing and the patients that I was helping monthly at the clinics. And so I think I saw medicine as a way to make, you know, tangible efforts in the research realm in terms of translational things that could help my patients, but also, you know, being able to work with them one-on-one and really develop connections with them. And it seemed like medicine was the best of both worlds for me to be able to do that. And so I'm still on the cardiology train at the moment. We'll see if that changes after 3rd year, but yeah, I became interested in that in undergrad, and we're still going strong. So yeah.
Great. Can any of you maybe recall on or remember any like specific interactions? I think some of you already started talking about some of those interactions, but any specific interactions you had with a healthcare professional or a patient or anyone that like really played a key role in helping you decide to apply to medicine, or maybe just like cumulative little interactions? Like, was there an aha moment for you, or just, you know, you just realized suddenly this is what I want to do?
I can go ahead and take this first. For me, it's definitely a cumulative of all my mentors. I have a lot of mentors in a lot of different spaces. And for me, that really worked because I feel like I have really wide interests in a lot of different things. And so I had you know, doctors from my EMS experience who were in the ED who I would see all the time. That were definitely very inspirational to me. My mother is a huge inspiration to me. She's my favorite person in the whole world, and I really look up to her, and she's definitely somebody who I can also consider a mentor. And I had a lot of other mentors from sort of shadowing and things like that, as well as mentors from research who are also physicians. And all of them were in different specialties, different fields. And it was my conversations with them and sort of understanding why they got into medicine, just finding sort of our shared points, what we found in common, that really made me feel like I could see myself in medicine. And that was really important for me, is to get that from like a lot of different people, just so that I could feel confident that this was really the path for me.
I think like Emilia, I had a lot of great mentors. It takes a village. It really takes a village to get people on this path, and also to get us to this point. I had like plenty of doubts. Like I knew I wanted to do medicine, but I had plenty of doubts growing up. I also had a lot of people, I was telling Emilia this. I had a lot of people tell me like, you're a girl, like you should think about your family and like when you're gonna get married and have kids, how you're gonna do that if you're all busy all the time. And I was like, I mean, maybe they're right, but this is like something that I want to do. And so having people tell me it's doable, having women mentors tell me it's totally doable. A role model I had was my mom's neurosurgeon, and she has 3 wonderful kids, and she's able to make time. She's definitely not in the easy specialty either, but she can definitely make time for her kids, and she's got great papers, and all those things like kind of set me up to show me that I can do it. And having mentors that believe in you, even if they're not in medicine, having mentors that believe in you starts opening all sorts of doors. Like even if they open it like a tiny crack, that's really all you need to kind of make an opportunity out of what otherwise wouldn't have been one. So that's really where it came from.
Yeah, I totally agree with what Candace and Emilia have said. Having mentors, especially supportive ones and ones who will go to bat for you, is so important in undergrad when you're trying to decide whether med school is right for you, or you've made that decision and you're trying to get there. You need people in your corner. So I think just a recommendation to everyone wanting to go to med school, it's so important to find those mentors that will be in your corner and will have your back. Definitely spend the time to find those folks, and it's okay to find somebody and think that you want them to be your mentor, but maybe it doesn't work out. Maybe you don't have the chemistry or the connection. It's okay to move on and find somebody else who might be better suited for you. But yeah, I was lucky enough to have several mentors that I really looked up to, kind of in the research realm, and also doctors. I shadowed a heart failure cardiologist, and I just loved her. I thought she was like so powerful and strong, and she was so strong-willed, but she also just was a really great role model and example for me. And I kind of looked up to her and thought like, hey, I can do that too. I also had incredible family support. I was really lucky to have such supportive parents and my brother who always cheered me on. And they were kind of like my sounding board. If I ever wanted to take on something new, I would be like, hey, what do you guys think of this? Like, should I do this, or should I switch gears or kind of go this way? And so I really spent a lot of nights kind of strategizing with them. And then in terms of like patient interactions that really inspired me, I kind of touched on one already with Flying Samaritans when we would do clinics in Mexico. I spent a lot of time doing that, and I also did something similar in Tucson. I was a part of like a preventative mobile health unit. So we would do blood glucose, like diabetes screening, hypertension screening, things like that. And so even though I did not have like a medical license, I wasn't qualified to give anyone medical advice, but I could talk to somebody about the importance of keeping your A1C in range, the importance of, being in the correct range for hypertension and kind of the causes, and, downward sequelae of that if it gets a little bit out of hand. And so I spent a lot of time doing that, like preventative health. And I found that was really rewarding, just to have conversations with patients and sit down and talk to them about what their daily life is like and how we can make small adjustments here and there for their benefit down the line. So I really enjoyed doing that. And yeah, I think that in combination with all of my wonderful mentors really just kind of helped me get to where I am.
Have any of you had any experiences as medical students? I know it's a little early maybe for MS1s, but actually you guys have been MS1s for a while now. Have you had any experiences as medical students that have reaffirmed your passion for medicine? It doesn't have to necessarily be a patient interaction, just anything.
I don't know if this is UCLA specific, but I think through a lot of our education, especially like when we practice, how do we interact with patients? How do we be sensitive? How do we, come to this healthcare space with a trauma-informed, mindset? All of these things makes me realize like how important the work that we will do is, and also how important this work is to do now. And it really, for me, it really highlighted like the main thing that I wanted to get out of medicine, which was that I wanted to help people. And I wanted to help people in a way that was very personal and is vulnerable, but also rewarding. And you get the highs and the lows. And I mean, like I, shadowed in labor and delivery, and I got to participate in a C-section. And so I got to participate in like the birth of this little baby girl, and listen to the parents like try to figure out what to name her. I got to hear her first cry, and that was incredible. So you get all these incredible highs, and sometimes there are lows too. In the same, like at the same time I was in there doing this, like working on the C-section, there was another mom in labor, and her baby was only 28 weeks and wasn't going to make it. But all of these things together, even though it wasn't the greatest outcome, we tried our best to be there for her. And that, even though it wasn't the best outcome, it was reaffirming to know that in other people's worst moments, you can be there for them, and you can also be there for their best moments. And so it felt really good to just know that even if I'm just like suctioning off the blood on the side, I could make a difference. And so that was nice.
I am really privileged to do work with the student-run homeless clinic here. I feel like I'm really lucky because with COVID, they had to really sort of cut down on a lot of their operations, but I think we're hoping to expand that once again fairly soon. But I feel like I got really lucky being able to get in there. You might have heard of the student-run homeless clinic here at UCLA. Mobile Clinic Project is our other big homeless clinic outreach. And that's really been where I get a lot of my sort of my fulfillment. It's really easy to sort of lose. This is just my opinion, so take it with a grain of salt. I feel like it's really easy to kind of lose your motivations or your passions in the sort of minutiae of med school. The lectures are hard. We're in the renal block. The kidney is not coming easily to me. I feel like it's really easy to just get lost studying all day, and it's been really important for me to have outlets like that remind me why I'm doing this and why I came here. I totally agree with Candace though about our curriculum. We have a new curriculum. DGSOM is really proud of its curriculum, so you might have heard about this transition to the HEALS curriculum. We have a lot of really important changes that have been made to teach us about health equity, about structural racism, about social determinants of health, and about trauma-informed care. And it makes me feel like I'm really going to become the physician that I want to be. And that's also very comforting to know that I will be able to do the work that I think I'm going to do, if that makes sense. But then it also has been important to sort of get involved with initiatives that I find meaningful right now. And for me right now, that's working on the housing crisis, working on homelessness outreach, and I hope to find more initiatives that get exciting. Also, just like shameless plug for Med Mentors, because another thing that really sort of keeps me going and feeling excited is meeting with you guys who are a lot of you who are in the cycle, feeling like I can sort of pay forward the mentorship that was given to me. I love mentorship. I feel like that's a way to donate your time that's really it gives you the good feels. And so I feel like it's important to find your happy one way or another.
I'll talk about a patient I actually saw really recently. It was just last week. I was on the inpatient rounds, and I saw a woman who had pancreatic cancer, which has a really, really poor prognosis. And she had a pretty large mass, and it was obstructing her biliary tree as well. And unfortunately, she also had dementia of unknown origin. And so in that moment, you kind of realize like there's nothing more that we can do for her. There's no treatments that we could give to make her feel better or like to cure her of what she has. And so in that moment, you realize like, okay, right now I just need to be there for her and comfort her and listen to her if she wants to talk. And you're really grounded in the humanism of medicine in those moments, because you're not trying to make a differential diagnosis. You're not trying to figure out what to treat her with or anything like that. And so it just kind of brought me back to like why I did this. It's because I'm trying to make an impact on someone's life, whether it's actually treating them and curing them of something, or just being there in the room with them and sitting and sharing a moment with them. And so I think that's kind of what keeps me going.
Just really quickly, I wanted to jump back in and just touch on like mobile clinic. So I put it in the chat as well, because sometimes it's hard having to deal with the inherent structural difficulties, like whether it's in insurance, with the lack of safety net for a lot of folks who are unhoused or don't have good income or are unable to afford health insurance. Sometimes it's hard facing these things because you can't fix the world by yourself. But it's these moments that make it worth it. Like being in the mobile clinic, by the way, the mobile clinic was started by a med student about 20-ish years ago. So any one of you can start it and make a huge difference. But it's one of those things where even if you have all these tough moments, there are these little gems, whether it's, one time I had a kid come in, awful prognosis. It was his third time trying to battle cancer, but he had this biggest smile on his face, and like cancer was the last thing he wanted to talk about. He's like, I got this, I can deal with this, I just want to talk about the new Transformers movie, like and just being able to see like a patient who's struggling smile, or be able to make somebody who's in pain laugh, or someone telling you that you made their day. Those small things really make a difference, and that's what makes it worth it, even through like the thick and thin.
What are some of your favorite memories that you've made so far as medical students? What are some of your favorite things about being a medical student and medical school in general?
Okay, gut reaction. In your pre-med classes or your post-bac, whatever, wherever you're learning your, basic stuff, a lot of times you're like, why am I learning this? This doesn't impact my life at all. Why am I learning? And the fun thing about med school is it all starts coming back. You start tying everything together. You see the big picture, and you got lots of friends who's there struggling with you. I was actually, I was on campus on Saturday, and every one of our study rooms was like taken by groups of students just trying to understand cardio and renal before we take our exam. And it's just such a good environment to like start pulling all that knowledge together and understand like why we're learning all this, why we're doing all this, and have everything come together. And it just starts making so much sense. You're like, that's why I'm doing this. That's why I'm here. And those moments are great. I love my classmates. I love the school, if you can't tell already.
I'm trying to think of like one like a good representative moment, but just like I don't know, we really do have the best class. I really am convinced that somehow
we got some MS2s and 3s here, so maybe we should say that.
But maybe they think so. Maybe they think they have the best class, but I'm convinced that we're like we I feel like the people at the school are just so giving. I have like so many, I don't know, like every time we get together as a group, it's like a lot of fun. I think like we know how to have a good time, but also like the MS2s and the upperclassmen have been so giving in terms of like resources and like tutoring and like, I don't know, there's just so many examples of like collaboration. I feel like that's one of the best parts. But the other thing is like these moments of like consonance, like these moments of like, wow, I really worked really hard to get here. I didn't think I'd make it, and here I am. And also this is where like I'm working to like go where I want to go. I shadowed in the ED last week, and it was really this moment of like, ooh, it feels good to feel like I'm on the right path, you know? I think that has to be the best part.
Just really quickly to jump in, I wanted to mention a story about one of our classmates, Tori. I don't know if you know about the story that I'm going to say. We really are a family. We really, truly are a family. And the reason I say that, one of the first, yeah, it's a good story. Like right around the beginning of the school year, you know, everyone's new, everyone's trying to get to know each other, but we figured out that one of our classmates, his wife is having a baby. And so we put together this whole thing. We added everyone except him to the group chat. We planned this whole like little surprise during one of our big classes. Everyone chipped in, and we were able to get him lots of baby supplies, like an $800 gift card. And just to surprise him with this massive card that has all of our best wishes for him and his family. And this man is a Navy SEAL, like he was an ex-Navy SEAL, and he started crying in the middle of class. So, and UCLA onesies. And so it's just, we really are family, and we really support each other, because med school is really hard. But we help each other make it easier. And sometimes it's just moments like that where it's not even about the school, it's about being real people and, you know, taking care of each other.
Yeah, I totally agree with what everyone said. The support system here is totally unmatched, not only within the class itself, but also like academic support office. We have a behavioral wellness center, which is so wonderful. They offer like mental health resources for students, and it's all free for students. So I think that's so wonderful. There's a lot of support here. The professors are always so willing to like meet with you one-on-one if you're struggling with something. You have the tutoring services. And not only that, but LA's great because you can like find what you like to do on your free time. Like the beach is literally like 10-15 minutes from us. You can go hiking. There's tons of food, like coffee shops, like anything you could ever want to do. I swear we have it in LA. So that's been really nice. And yeah, I think everyone pretty much touched on everything that I agree with as well.
Well, med school is awesome, and you ladies are definitely making it sound awesome. But I think we all know that, you know, there's ups, there's also downs. So med school can get tough sometimes. It can be a lot. So I was just wondering how do you persevere and how do you stay motivated when med school gets tough?
I could take a stab at that. So one, figure out your support systems. Make friends, take time to make friends. I know there's like this inherent desire, like I gotta ace everything, I gotta study all these things, I gotta go to all these classes. Take time for yourself, make friends, go out and have fun, because all of these things are what's gonna get you through the tough times. And then just to add on to an earlier thought, like what Emilia said, find what makes you happy, whether that's being in a clinic and helping other people, getting a dog, whatever it might be. You need to do these things for yourself, because burning out isn't going to help anybody, expect the least of all you. And so really focusing on taking care of yourself and knowing when to take a step back and say like, all right, I need to light a candle, take a bath, drink some wine, whatever it might be, to take care of yourself. That's going to be so important. And just having friends to be there and do that with you, so key. The second thought that I have is imposter syndrome. Everyone has it. So if you're struggling, I bet you, you bet your bottom dollar there's someone else that is also struggling. Don't think that you're doing this alone. You literally have a whole class of other people and generations of people before you who have made it through, struggled, and every single one of them had a moment of self-doubt where they're like, am I qualified to do this? Can I do this? Should I be doing this? And the answer is yes, yes, and yes. So just take it with a grain of salt, but everyone gets a little bit of imposter syndrome sometimes. So just take a quick break and go on a walk, enjoy your life. That's gonna be the most important part.
I always say, you know, find your happy. But I think I already touched on that, and so did Candace. Yeah, find the things that make you happy and absolutely go for it. But I totally agree with everything Candace just said. But I also just want to remind you that like you're already on a pre-med journey. This is the journey that will take you towards becoming a physician, and med school is just an extension, I feel. So all of the things that are working for you now should be the things that hopefully that work for you in med school. Med school is not like I just want to like demystify it a little bit. It's not like an unknown beast. It's the same. You know, the stressors are the same. It's school stress, it's exam worries, you know, it's worry about whether you're gonna make it or not. And you know, those were a lot of the same, at least I can speak from my own experience, those were a lot of the same worries that I had when I was trying to apply to med school as well. And so the things that help me to feel to de-stress and to feel like I'm on the right path and that I'm confident in myself are the same sort of strategies that I try to employ even now in med school. If you find that maybe you are struggling as a pre-med and you're sort of figuring out what works for you, I would really encourage you to employ these tactics as well, because they'll work for your pre-med journey the same way they'll work for your med school journey. You know, find the things that make you happy, authentically pursue them because they will take you to where you need to go. That's sort of my piece, I think.
Yeah, I would definitely advise if, you know, you haven't become super good at giving yourself that time to decompress and relax and find, you know, what makes you de-stress right now in your life as a pre-med, definitely work on that and make that a priority, because then you'll just get really good at it and you'll be able to transfer that into med school, and it'll become kind of second nature for you to be able to do that when things get really tough and maybe your workload is a little bit more in medical school or a little bit more demanding. So that's something I would really highly advise, is like figure out what works best for you right now and then see if you can translate that later on. But yeah, it is so important because we can often get overwhelmed with like, oh, I have so much on my to-do list and I could spend an hour doing, you know, walking outside, but I could also watch lecture because I'm behind. But it's like you have to make a priority list and understand that if you don't give yourself the time to decompress and you don't practice self-care, then it's just going to impact you later down the line in a negative way. So just kind of look at it like that in terms of like your priorities. And I don't think anyone can ever check off everything off their to-do list. Like there's always stuff that you're going to end up doing tomorrow you didn't get done. So, but I would say that self-care is something that you shouldn't keep pushing forward. So definitely find what makes you happy, find what makes you relax, de-stress, and start practicing now.
One last thing I might add is get used to not knowing. There's a lot of things to learn. Medicine is one of those things. There's so many nuances. And that's why we have like over 170 specialties, right? Because there's just so much to know about so many things. So get used to not knowing. Don't panic when you don't know something. Take it upon yourself to like learn something new and be proud of that. Bounce back and learn from failing. Like it's okay to fail. It's okay to not know. Just don't take it personally because there's so many things to know and no one expects you to know it all.
Yeah, really good points. I definitely agree with that. Good to feel comfortable with not knowing something, not knowing an answer, not knowing what you're going to do. It's okay. Okay, maybe we can move into some of the questions that we got in the RSVP form. We got a lot of wonderful questions. Some of them might be, maybe like some of you might have already touched on some of these questions, but feel free to just add on anything else that comes to mind. So we have this question here. How has your appreciation for medicine developed since being pre-med and now in med school? And how do you cope with the not so great parts of medicine or healthcare? Do you believe that you can change these things with your actions? That was a loaded question.
Like, what a great, like, astute question, right? I think you've definitely hit on something that a lot of us tend to wrestle with. A lot of us, speaking for myself, something that I also struggle with. I think, thanks for posting that, Martina. I just want to make sure I can answer all parts of your question. I think something that I needed to wrestle with, this was something I needed to wrestle with even before I got into medicine. And it's definitely a large reason for even why I decided to come to medicine. I think one of the beauties of our profession is that we get to do sort of one-on-one work. We get to meet individuals, we get to meet people and hear their stories, and help them using our knowledge, using our interventions, and get to be a part of that person's story. But we also get to then zoom out and then go on the macro level, and we have a lot of pull with our expertise as physicians. We'll get to we'll have a voice, we'll have a platform to then also speak on larger issues. I don't think that well, this is also just my opinion, so please take it with a grain of salt, but you'll be kind of hard pressed to find any profession that is entirely benign. You'll find hard work in any profession. I think in medicine, we have the unique privilege of a voice, and people will listen to us once we are doctors, and that's something that kind of keeps me going and makes me want to work harder to then solve these larger issues. It's hard to ignore that things can be messed up, especially in our healthcare system, but I feel like at least we will eventually. And right now, let's not ignore the power we have right now as med students and as pre-med students. We can start working on these things right now. And I think that's a lot of what makes medicine meaningful for me. A lot of what drives my work with the student-run homeless clinic is wanting to do the work that matters. And in LA, if you're in LA, you'll know that the housing crisis is one of the most dire crises we face. But still definitely a huge problem. And that's the work that needs to be done, which is part of why it feels so meaningful to do it. I would encourage you, if this is something that you wrestle with, to find an initiative that you're passionate about and start working on it now, because you'll realize the power that you have to make change, and that will only be amplified as you move through your journey in medicine. So it's actually quite empowering to feel like you can make a difference. And that's also part of why I chose medicine in the first place.
This is such a wonderful question. I just to address the first part of it, in terms of the appreciation for medicine and how it's changed since being a pre-med and now in med school. I think a lot of folks go to the doctor and they kind of think of oh, doc, I'm sick. Can you just help me out? Give me medication to make me feel better, and I'll get out of your office and leave. But I think what's so great about the education we're getting here at UCLA is you really view the physician-patient interaction as more of a partnership. You're a team. It's not necessarily the physician making all the decisions, telling the patient, okay, take this medication twice a day for 7 days and you're all good. But you really ask them what do you think is going on? We're really inquisitive. We want to know their feelings. We want to know everything about what they've been feeling. Tell us all the details so we can put a picture together, and not only just symptoms, but also how has it impacted their daily life? How has their quality of life changed? And we want to not only fix the chief complaint, but also everything else that the patient tells us, and just to see how we can make them feel better overall as a human being. And so I don't think I quite appreciated that as much until I got here, and I really understood like, wow, this is what my role is, and this is how I can, you know, play this role in my patient's life, and how we really actually like work together on this as a team instead of me kind of spearheading it. So that's just one thing. There's a lot of other things I could say to address that, but that's a big one. In terms of coping with the negative parts, I think Emilia answered that really beautifully. In terms of UCLA, I think, you know, we're really fortunate that we have a lot of advocacy at this school and a lot of programs that one can be a part of, and initiatives that you can join to kind of address this. But, you know, it's a longstanding battle, as we all know, but definitely like get involved in things you're passionate about, put your heart into things. And fortunately, if you attend UCLA, there's tons of opportunities to do that. So.
Okay, can move on to another question. What do you think is a good way to get clinical experience now? How can I find out if medicine is for me?
That's a really great question. I don't know if you're asking specifically in the context of COVID, because I know that it's really tough to shadow. I would say that shadowing was really good for me, but my primary clinical experience was as an EMT. That's like a huge commitment. I wouldn't, you know, it's a lot of money also to get your license. So, you know, if you're not super into the world of EMS, I don't know that I'd actually recommend that for you. But if you are interested in EMS or interested in, you know, working on an ambulance, I found that to be a really, really unique and an interesting way to get a peek into medicine. I also know that a lot of people that I mentor are they work as scribes, or they volunteer in the ED, or they volunteer in the hospital. All of those are also great experiences at just getting a peek into what a hospital system looks like. I would recommend to you, if at all possible, to make these longitudinal experiences. From at least my experience, it's hard to understand something deeply with like one visit. So like shadowing for like 4 hours on one day. If you're able to, I would urge you to go for experiences where you can come back, even if it's shorter visits at a time, even if you're volunteering for only 2 hours as opposed to shadowing for 4 hours, but you're volunteering every week. I feel like that really, you'll make a lot of good relationships with the people who you volunteer with, and the, you know, the nurses and the staff and the doctors who are on that unit, and you'll actually learn a lot more. I would recommend, yeah, those longitudinal experiences.
I think it's important to not only get clinical experience with physicians, but also other healthcare professionals. And I know it's so difficult right now with, you know, the current situation, like to go out there and actually go and shadow them. But you could even talk to folks who are in different healthcare professions like pharmacy, nursing, nurse practitioner, you know, medical assistant, anything like that, and just try and get a perspective of what it's like. Because medical school is hard, you know, period. And it's especially hard when you're not really sure that this is what you want to go into, but you did it anyway, you know, so it's just going to make it 10 times harder if your entire heart is not in it. So I would really spend the time doing some introspection and seeing, is this really the field that I want to go into? Because it truly isn't for the faint of heart, but it's the most rewarding thing if you get into it. But, you know, you have to make sure that this is truly what you want to do, and you couldn't see yourself doing anything else. So definitely spend the time to figure that out.
Yeah, that's a pretty good segue actually into the next question that I have from the form. I know there's a lot of issues with burnout and struggles with motivation among med students, given how tough it is. How do you continue to stay in touch with yourself and your needs on this journey?
I would say try different things. I think I didn't really learn What, I guess how Emilia says it, what's my happy, until like very recently. And I just didn't try enough things. Like Emilia can tell you about crocheting. I can tell you about my knitting. I mean, I tried everything almost. Like just show them the bag. Show them the bag. Please just show them the bag. It's so amazing. She's incredible with crocheting. But it's just, you gotta try some different things, because some of the things that I grew up that I used to cope doesn't work anymore. And it just, maybe it never worked, I don't know. But you know, whether it's reading a book, I've gotten really into bats recently. That's why I keep bringing it up. But you know, it's just try different things. Maybe it's kayaking. You know, by the way, UCLA Marina, I'm going to put in a quick plug. You can go rent kayaks for free. My friends and I did it last Saturday, or like my classmates and I did it last Saturday, and we got to get like this close to some nice fat sea lions. So you really try different things, because sometimes it's going to be one of those things that really is, you know, you're happy and you just haven't found it yet. So that'll really get you through a lot of tough times.
I actually struggled a bit with this, I would say within the past year, just with COVID, you know, getting really bad again, and a lot of the restrictions on our opportunities to see patients, and also the restrictions on in-person events, you start to get bogged down with, you know, being in your apartment all the time, like not being able to go out and actually see patients, or in my case, like ignoring a complete part of a physical exam because we're not allowed to do it because of COVID. And so it just, you know, starts to kind of build up, and you kind of feel a little bit like you lose your why. And I honestly, I did think that happened to me a little bit this past year. But in those moments, I would just think about why I decided to go into this field, and I think about the future and like what I'll be able to do as a physician, the impacts I can make, and eventually when I'm on the wards, like those relationships I'll be able to have. And thankfully now things are a little bit better. We're allowed to like shadow again and stuff. And so for me, it just takes like having a day in clinic and seeing people, and then I feel better because I'm like, okay, this is what I want to do. This is what I enjoy. This is what I love to do. But it is tough. I think the past 2 years have been really tough, and I'm sure that there's a lot of folks in my class and the ones above me and below me who have experienced burnout and struggles with motivation and kind of questioning, like, what am I doing? Because I'm not actually doing what I thought a medical student would be doing, because our years have looked really different compared to ones before us. But yeah, it just takes a little bit of introspection and just kind of remembering why you did this, and think about your long-term goals, and then that helps. At least that helps for me.
Yeah, I completely relate to what everyone said so far about trying a lot of different things, but then also COVID having this sort of really dampening effect where like it's really hard to feel like you remember what feels great. Something that really helped me was journaling. I really liked being able to write down my thoughts and feelings. Sometimes I feel like my brain goes a lot faster than, you know, what I can handle. And so by writing things down, it forces me to slow down and really take a look at what I'm thinking, what I'm feeling. So journaling really helps for me. I feel like a lot of your typical like self-care kind of things really helped sort of the you know, like the pillars of like meditation and things like that really help me to sort of center myself. It's not something that I do as often as I'd like. And this is actually a really great reminder for me to do it more often, because it is something that I find helpful. Hopefully it's something you find helpful too.
Yeah, I could not agree more with what has been said. And yeah, Keely and I are in the same year actually. And I feel like, you know, everyone has been struggling with this like remote learning, but I feel like our class specifically, we've had, I want to say 85 to 90% of all of our first 2 years of medical school online. And yeah, just like Candace mentioned in the chat, I know the chat doesn't stay in the recording, but you know, med school can be really isolating, and it's, I don't know, like Yeah, I just completely agree. Very easy to feel isolated, especially when everything is remote, when you're not technically allowed to shadow, when you're not allowed to see patients to do it. It's like, it can be really frustrating. So definitely super important to take care of yourself and prioritize yourself and your mental health. Because yeah, it's not easy. Okay, so maybe we can do a couple more questions. This was a question that was asked in the Q&A, and Christina, our lovely Q&A responder, answered, but maybe I can just open it up to everyone else here. So what were some of the strategies used to balance your academic and patient care experiences as a pre-med student?
I'm definitely not the person who you should listen to, but I will say, God, a lot of times I put patient care first because sometimes you're just stuck in the weeds with the books and the studying and the lectures, and you forget why you're doing all this. You get so caught up. God, to this point, I still don't know the Krebs cycle. I'm going to be very honest with you. But sometimes you get stuck in the weeds and you forget why you're here. And I'm here for the people. I'm here for the patients. I'm here for those experiences, those tiny moments that you take home with you. And sometimes it'll pop into your head and then it makes you smile. And I probably look like a psycho walking down the street, but those experiences matter so much. And sometimes I put that as a priority. Hopefully not every day, but every once in a while, like put that as a priority because it reminds you why everything you're doing is so important, and reminds you what a big difference that even somebody like me could make.
I have a really similar answer, which is just that I think if you do it based on what I tell you or like what a rule tells you, it's not going to be authentic. I really just think like you should just do the things that make you excited and do as much of that as you can. It's hard to say like what exactly you should do. My patient care experience was EMS, which is like kind of different than like a shadowing or a volunteer kind of a thing, because it required sort of like shift work. So I don't know that like I'm the best person to answer this either, but I think like by following like what you're authentically interested in, you'll have a good balance for yourself. I know that that's kind of hard because if you're interested in everything and then the question comes like, how do you balance it? That's a really tough question. It's hard for me to answer that for you. I think, just try to balance your time between the things that you find interesting, and ultimately, it'll work out.
Awesome. Maybe we can do one more question before we wrap it up. How has your why for medicine helped you get through the struggles of med school? These are all pretty similar, but
Yeah, I think I've covered this a little bit about sort of finding your happy. My issue in med school is I get really bogged down in the sort of minutiae of studying. It's not easy. I'm just not the kind of person who likes to study for hours upon hours upon hours. I really need to cut it with something more patient facing, more people oriented. So yeah, I think just keeping that in mind, like I try to get involved with things that are people facing, and whether that's mentorship or whether that's like homeless clinic, and I only do that at once every so often because that's sort of limited in terms of COVID, and in terms of opportunity. But as long as I get out there and do something that makes me feel like I'm helping people, I feel great. And so that's how I deal with, you know, having to study for hours upon hours upon hours.
Yeah, I definitely think when things get tough, it's always important to turn to yourself and practice self-care, but also rely on your support system, whatever that looks like for you. And then also, you know, just kind of think introspectively of like what your why is for medicine, like maybe set a few like goals for yourself, and that kind of like keeps you kind of on track when things are tough. Especially like if you're not able to go see patients, or you're not able to do this or able to do that, well, what can you do? And kind of think about like, okay, this is the impact that I want to make in these 4 years or as a physician. What can I do in this moment to kind of work towards that, and kind of think and reflect on things that are important to you and get involved in that? Because it is so true. Like, it's so easy to just like get into this groove of studying 24/7 and like you don't do anything else. And that's something I felt like is a really stark contrast with undergrad, because I felt in undergrad like I was running around doing a million things and I was always busy, but I loved it because I was always working with people. I was always like seeing people every single day and like going to this club meeting, going to this club meeting, going to clinic, all that stuff. And like now it's a lot different because a lot of my time is taken up with studying. And so I find that when I have more of a balance between studying and doing things that I really enjoy, like being involved in like an interest group or going to SRHC, which is the student run homeless clinic, or going actually into clinic and seeing patients, like when I really make an effort to have more of a balance, I definitely feel like I just feel a lot more like rewarded, and I feel a lot happier and in general. So make sure that you are pursuing what truly makes you happy and pursuing the goals that you have for yourself.
Okay, I think we are at exactly 8. So maybe we can wrap it up here. Thank you so much to all of our panelists and Q&A chat responder for being here and sharing your insight and your experiences. We all love medicine. It was a really fun evening for me listening to why you all love medicine. And thank you all to the attendees who joined, and then to everyone who will be listening to this in the future. But yeah, if you have if anyone has any final comment or anything they want to close with.
I'll just say, you know, like, I hope some of the things that we said today resonated with you. We just represent, you know, a couple of opinions. And so even if it didn't resonate with you, I'm sure there's someone in medicine with whom you resonate. You know, this is a really large community. And so find your people, and you guys got this.
Just to reiterate that you can do it. It's a tough path, but if you love medicine, if you love people, if you love making a difference, it's so worth it. It's so worth it. And I believe in all of you, and you're going to do great, and everything's going to turn out okay. I cannot stress this enough. Everything will turn out just fine.
Best of luck to you all, depending on whenever your application cycle will be. But definitely feel free to reach out to me with any questions. I'm always happy to chat.
Okay, good night, everyone. Have a good evening. Bye.